All right, so before I come into the patient's room, I would have taken my vital signs, and they were all within normal limits, so there's nothing of concern. So I'm going to do my hand hygiene. Knock, knock. Hi, my name's Alex, and I'm going to be your student nurse today. And can I have you verify your name and date of birth?
Yeah, it's Skylar Salazar, June 9th, 1965.
And do you have any allergies by any chance?
No, no allergies. Yeah.
All right. All right, Skylar. Well, I'm here to do a head to toe assessment, so I'm just going to check on your whole systems and make sure everything's all right. But I checked your chart and you're here for a hip surgery, right?
Yeah.
That's on your left side.
Yep, left-sided hip surgery. Ow, that kind of hurt. Yeah.
How has that been?
It's been pretty solid. I think the recovery's been going well. Pain's been getting better and better each day. Yeah.
Okay. All right. So about that, do you know when the last time you had any pain medicine for it?
I had pain medicine an hour and a half ago, I believe.
Okay. And how's the pain right now?
So it's about a 3.
Okay. And is that your tolerable level?
Tolerable is 4.
Okay.
Yeah.
And do you know anything that makes it better or worse?
Just movement kind of hurts a little bit, but that kind of, that's about it. And then just like not moving very much makes it better, and then of course the pain meds make it better.
And this pain's only after the surgery, right?
Yeah, this isn't normal. Happened. I mean, when I had my hip fracture, that was pretty bad, but since then it's been getting better. But before that, no pain.
Okay. All right. Well, I'm going to do my assessment now. So we're going to start from the head and move down through your body systems. So I would put on my gloves, and if you could lean your head forward, I'm going to check the back of your head, feel for any bumps or abnormalities behind your ears, for any ulcers. It looks fine. You can rest back now. And I'm going to check your nose, make sure bridge is intact, and then looking for tracheal deviation or JVD, and it looks normal. And I'm going to check your pupil reactions. So if I can have you look straight ahead, and I'm going to shine the light onto your eyes. The other one. And then I'm going to have you look straight ahead, and then look at the tip of the pen, and back straight ahead. Okay, that looks normal. And then if I could have you puff your cheeks out, and then stick your tongue out, and then raise your eyebrows, and do a smile, and a frowning face. All right, it looks symmetrical. Everything looks fine. And the pupils were round, equal, and reactive, and they were the size of a 4, I'd say. About your head, have you had any headaches?
No headaches.
Any trouble with memory?
No.
And what about any trouble with your senses, with vision, hearing, smell, taste?
No.
No hearing aids or any aids?
No hearing aids, no glasses.
Okay. And about your heart, have you had any chest pain?
No.
Feeling lightheaded?
No.
Any history of a cardiac surgery?
No.
And family history?
No.
Okay. Well, right now I'm going to take a listen to your heart sounds then.
Okay.
So I'm going to listen over a couple landmarks here, and then I'm going to listen to your apical pulse for a full minute.
Okay.
All right, your heart sounded like it had a normal sinus rhythm, so that's what we expect. S1 and S2 sounds were there, and it was a rate of 70. It's pretty good for a resting heart rate. So, about your lungs, have you had any history of asthma
No,
or any other breathing issues?
no,
Any trouble breathing?
no,
Do you smoke anything?
no,
No coughing or coughing up anything lately?
no.
All right. Well, I'm just going to take a listen to your lung sounds now.
Okay.
And then after I finish listening in the front, I'm going to have you turn so I can listen to the lung sounds in your back.
Okay.
You can take a deep breath in and out. And in. Again. Again. Go ahead. And one last time. All right. Now I'm just going to lay the bed flat, and then I'll have you turn on your side.
Okay. How my
And
lungs sound?
Oh, they sound clear bilaterally. No whooshing. No abnormal sounds.
Nice.
So I'm just going to have you only bend at this knee.
Okay.
That's good. And if you can grab onto the rail there and help yourself turn.
All right.
All right. And take a listen again. Go ahead and breathe in. Yep. And out. In and out. Go ahead again. Go ahead. In and out. In and out. In and out. Last one. Okay, and I'm also looking at your back here. Do not look like you have any pressure ulcers, and your skin looks intact. Okay, you can come back now. All right, we're looking all good there. So, about your gastrointestinal system, have you had any nausea or vomiting?
No.
Have you had any trouble passing a bowel movement?
No.
Do you know when your last bowel movement was?
This morning.
And was that difficult to pass? Easy?
Yeah, it's normal.
Normal?
Yeah.
All right. Well, I'm just gonna pull the pull the curtains here for some privacy. And then if you could lift up your gown, I'm just gonna inspect your abdomen. I don't see any abnormalities, no lumps, no bruising. And I'm gonna take a listen to your bowel sounds. Make sure everything's working fine.
Okay.
So I'm gonna listen here for 15 seconds, hearing 5 to 7 bowel sounds. All right, they sound normal active. And do you have any abdominal pain?
No.
Okay, I'm just gonna palpitate around here, and you let me know if you feel any pain or discomfort.
Okay. That kind of
Sorry.
Sorry, I'm ticklish.
They're not painful, right?
No pain.
Okay. All right. And while we're here, I'm gonna palpitate your bladder down here. Just gonna pull that down a bit. It's all right. Does that hurt? No.
No,
You don't feel the need to void?
no.
And I see it doesn't look distended, so it's not expected. All right, you can pull that back down.
All right.
And with your urine, have you had any trouble with that? Passing it? Any pain?
No, no pain when I pee. Just looks yellow and clear. Yeah.
It doesn't have an odor?
Yeah, no specific
Odd
abnormal
odor?
Yeah.
Okay. All right then. That looks good then. I'm gonna have you sit back up now.
Okay.
And then next, I'm just gonna test some of your strength. So I'm gonna check your grip strength.
Okay.
Is that high enough?
Yeah, solid.
All right. If you could just squeeze my fingers here. Okay. And you could keep squeezing. I'm gonna pull up and you resist.
Okay.
And then I'm gonna push down and you push up.
Okay.
All right. And if you could raise your hands up to the ceiling. Okay. Just looking for any pressure ulcers. And I don't see any on any side. You can bring them back down. Looks like you have good shoulder mobility.
Thank you.
And now I'm going to check both your arms. So you let me know if you feel any numbness or pain, anything abnormal.
Okay.
Feel anything odd?
No, that all feels pretty normal. Yeah.
And I don't see any puffiness, no swelling. Skin color looks appropriate for ethnicity. And if you could keep your arms like that, I'm going to check your pulses here.
Okay.
All right, they're both equal on each side, +2, so they have a normal strength. I'm going to check your cap refill. It's rather instantaneous. Okay, and that should be good for your arms then.
Cool.
Now I'm just going to check your feet, and I know you have that hip replacement surgery there, so I'll get on that after I check your feet here.
Okay.
So I'm going to check, and tell me if you feel any numbness or pain.
Nope.
Nothing?
Nope, just tickles.
All right. And then if you can point both of these toes up, good, and down. And I'm going to check the pulses here. And the socks will be off, so they're both equal and +2. And equal there as well and +2.
All right.
So before I check the strength of your feet, let me just look at the surgery site.
Okay.
So we would move the gown here, only appropriate to expose the site. And I would check the site for any swelling, check if it has any drainage and how much drainage, the color of the drainage, if it has any discharge or pus or a foul odor. And then look how the site is healing, when the last dressing change was, and when it would need to be done if needed. And so far it looks to be progressing good. I don't see any abnormal amount of drainage, no bloody drainage, no signs of infection, no fever, and the pain is continuing as expected and it's getting better. So now we can check your feet strength.
Sweet.
So I know that one's probably painful to move up. So are you able to tolerate moving this foot up?
Like I can do that a little bit, but anything more kind of hurts.
Okay, you could just go as far as you can. So if you can lift these feet up.
Okay.
Okay, that's fine. If you can bend at this knee. and push it out. Okay, that's good. You can raise it back down. And we won't have to bend this one, so that one will be fine.
Okay.
So have you been getting up to walk?
Yeah, I've been getting up to walk, trying to go as much as I can. I walked a little bit today with the walker.
Okay.
Yeah.
And therapy helps you with that?
Yeah, therapy or the CNA sometimes.
Okay. And you don't have any trouble with that?
No, I mean it's definitely a little bit more challenging, but it's part of the recovery process.
Okay. And how about life at home once you're out of here? Are you worried you might not have a place?
No, it's cool. I live with my wife and my kids, and my dog, and we always got food on the table and all that good stuff.
All right. No issues with transportation?
No, no.
And you think you'll have someone to take care of you there if you need?
Yeah, I'll be good.
Okay. All right. Well, we're all done here then. I'll let the doctor know that you're progressing well and check on your pain meds, see when the next one is due.
All right.
Are you okay sitting up there?
Yeah, this is solid. Yeah.
All right. Well, here's your call light, Mr. Salazar. And just ring if you need anything. I'll be around here.
All right. Thank you.
All right. See you later.
Bye.